where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. We're going to carry on the orthopedics talk this evening and orthopedic surgery on November 6, 2018. So I'm glad to have you on this Tuesday evening. As you know, we're on allcountyhealthcare.com's website. All the shows are there, and I'm sharing right now to Facebook Live. There's another catalog of shows there. And there it goes. That's great because, you know, social media is huge nowadays. So we're everywhere. We're on FM, AM, and social media. But without further ado, I want to welcome Dr. Eric Shapiro. He's an orthopedic surgeon, sports medicine, arthroscopy, and general orthopedics doctor here in Palm Beach County. Dr. Shapiro, welcome to the program. Welcome back to the program.
Thank you. Great being here.
Thank you. And I always tell people I'm glad to have you on this adventure of health. Please tell the viewers a little bit about what you do, your medical specialty, and what is your focus? Because I know orthopedic surgery can pretty much go from the chin to the foot, right?
The old days, the old general orthopedics did everything, but now we do 5 years of a residency in orthopedics, and then I did a 1-year fellowship in sports medicine. So right now I do mainly 99% shoulder and knee, conservative care as well as operative care. I also see in the office, though, I see necks, I see backs, I see ankle. I usually don't do foot or ankle because in our group we have a hand specialist and a foot and ankle specialist.
Yeah, we're going to talk a little bit about that. You have a super large orthopedic group. I mean, like you said, there's hand and foot, there's a reconstructive specialist, spine specialist as well. You even have a neurologist in there that visits the practice, sports medicine. I did have Dr. Wang on here not too long ago, about a year ago, reconstruction, hip and knee replacement. I mean, just about everything.
So pretty much everybody now is I would say 98% of the people do a fellowship after. So you learn everything, but then you really, specialize for 1 year in that one area. So I do shoulder and knee. Dr. Stukin, who's a junior sports medicine guy, does more of the instability work. Dr. Wang and Dr. Grandick are hip and knee replacement. Dr. Luskin does hand. Dr. Kinman and Dr. Garzone do foot and ankle. And Dr. Belush, who's been with us for about a year, is a fellowship-trained spine surgeon. So everybody in our group is fellowship-trained and also trained at excellent institutions.
And just tell us again, fellowship trained, it's an extra year of a specialized training.
Yeah, so people don't realize. So we do, 4 years of college, 4 years of medical school, 5 years of residency, and then a year of fellowship. So I didn't start my practice until I was 34 years old. So it took that long to really get into your own practice. And even then, since I started, I'm in my 25th year, I've done over 7,000 operations. So, I try to be conservative on people, but, certain people need surgeries, and a lot of it is just knowing who to operate on and who not to operate on. The goal is to get people better and with as minimally invasive as you can.
Nice, and that's a nice segue into one of the questions I have for you is, let's start out with non-surgical approach. I know baby boomer population is getting older, and seems like arthritis is genetic and also can happen over time, overuse. You deal with a lot of balls and joints,
Yep.
and that friction causes, correct me if I'm wrong, arthritic ailments. So how can you help South Florida residents suffering from bothersome arthritic ailments, arthritis?
So why don't I just discuss sort of somebody comes in and their knee hurts, just 45-year-old. So some of the people there's different reasons your knee can hurt. It can be arthritis. It can just be you sprained it. It could be that you tore a meniscus. You could tear a ligament. So when somebody comes in, I listen to them. I get x-rays. I do a physical exam. So depending on what they have, if somebody's x-rays look normal, I'll just tell them to take some anti-inflammatories. If it looks abnormal, such as arthritis, I will give a lot of people one corticosteroid injection, a cortisone shot. That helps about 50%. The younger people I'm more aggressive on. If I think they tore a meniscus, I send them for an MRI, which actually basically looks inside you without cutting you open. So I'm aggressive on fixing people under 50. In my patients over 50, I try to be conservative. Anti-inflammatories, cortisone shot. If somebody has arthritis, there's something called viscosupplementation, a gel that actually helps 60% of the people for 6 months to 2 years. If that doesn't help, either arthroscopy, if their meniscal damage is worse than their arthritis, going all the way up to a knee replacement.
So a little patient with the older patients,
Yep.
And you have a plan for both age groups. I like that.
We treat pretty much anybody from athletic injuries probably from age 10 on. We don't do pediatric orthopedics, but for a sports injury in a pediatric patient, we're probably better than just a pediatric orthopedist that does a lot of congenital things and fractures.
And 10 on nowadays, you have some centenarians, I bet, that you've taken care of.
The oldest person I operated on, and I always say the story with a grain of salt, I had one of my partners, one of my old retired partners, sent me a patient, and I didn't know how old she was. So I walk in the room, and I said, where's your mother? Because the patient was sitting there, didn't look old. She was 98 years old. And my senior partner, wanted me to do an arthroscopic surgery on a 98-year-old. And I just said, at 98, you don't do elective surgery. And she says, doctor, she says, I'm healthy. I'm on no medications. I used to walk 2 miles a day. Then I went to a cane. Then I went to a walker. And now I'm in a wheelchair. So I actually took x-rays, gave her the cortisone, tried everything. Nothing worked. Got an MRI, and she had no arthritis, and she had a torn meniscus. So I operated on a 98-year-old, and she was walking in 2 days. So that is not the norm. That would not be what I do every day. But the bottom line is you have to look at every patient individually, and you make a determination what's going to be best for that patient.
But you brought that patient back to a better quality of life. She was not healthy, maybe, in her entire existence, being in that wheelchair.
At 103, she came back to me and asked me to do a shoulder replacement, and I said, no, that's beyond. You can live with your shoulder, because you don't walk on your arms. But she did fantastic, and it really changed her life.
That's great. We're here with Dr. Eric Shapiro. He's at Orthopaedic Surgery Associates. And I'm going to give out the locations in a minute. Well, actually, I'm going to ask Dr. Shapiro in a minute. But let's carry on the conversation with non-surgical approaches. I heard that you do stem cell treatments as well. How does that work? Because that's always a hot topic.
Okay, stem cell is a very hot topic, and is it truly stem cells? That's the big question, too. So we do different things. I actually we call it placental allograft. So I actually take cells from the placenta of a pregnant woman going in for elective C-section. So the cells there more of them are supposed to be viable than taking them from someone's own body. The stem cells from someone's body, you can take it from your pelvis, from the bone marrow, or from somebody's fat. But unfortunately, it only is about 1 in 800,000 cells that are good. If we could grow them, which other countries allow, and then inject them, that is actually the best thing. But since we can't, it's against the law to what they call manipulate cells, I have been doing the placental allograft, which helps 70% of the people so far. The only negative is insurance does not pay for it. So I talk to the people, and I always try everything that is paid for first and be conservative. So conservative, anti-inflammatories, possibly a cortisone shot, possibly one of the gel shots, Then if it's too bad and their arthritis is too bad, I said you live with it, or a placental allograft / stem cell injection, or a knee replacement, or a shoulder replacement. And it's helped probably 70% of my patients.
That's fantastic. Again, we're here with Dr. Eric Shapiro. Going to be here till around 6:30. The number is 1-888-565-1470. If you have any questions, I want to make sure I give that out. Or on Facebook Live, just ask them in the comment bar there, and if they're appropriate, I will ask them to Dr. Shapiro. Do you also do this PRP that we hear about?
So PRP is good for certain things, okay? What people, they just take it generally. There's different types of PRP. Some have high white cell count. Some have low white cell count. That's almost too much just for the general population. But so people have tendinitis of their elbow, tendonitis like tennis elbow or golfer's elbow, or Achilles tendinitis. The high white count PRP has been beneficial for those patients. If somebody has mild knee arthritis, PRP has been helpful, but usually I usually do not do PRP on my patients.
Okay, but the stem cells you do, and that's good to know. I want to ask you, because as we talked before, the population is getting older, baby boomer population, my parents as well, and your practice focused on everything, but you said I think 90% of what you do is shoulder and knee.
So what I do mainly is someone, whether it be just evaluating their knee, a cortisone shot, or arthroscopic surgery, I don't do the knee replacements. Dr. Wang and Dr. Grandick do those. And then I do a lot of rotator cuff repairs. I do shoulder surgery. So people who have torn their rotator cuffs do not heal by themselves if they're completely torn off. So I always tell people, I'm conservative on the knee if you can be, because the meniscus is sitting there today and it'll be sitting there in 4 years, a little more torn up, but it's still sitting there. If you tear your rotator cuff, imagine a tenderloin steak attaching. If you tear the tendon off, it never goes back, but it will retract and shrink. So there's a timeline. Imagine a long sleeve shirt attached to your wrist. If you wait too long, it becomes a short sleeve shirt. Grab that short sleeve shirt and try to bring it to your wrist. It doesn't go back, and that's what your rotator cuff is like. So I tell people, if you hurt your shoulder, it wakes you up at night, and you're weak, you should see your orthopedist, because usually I'm very aggressive on fixing people's rotator cuffs.
That's what I was looking for in the comment there, because I was wondering, that older population, if they're, waking up at night or during the day, they're just like, that doesn't seem right. They should definitely go see Dr. Eric Shapiro. Dr. Shapiro, we're going to take a quick break, but before we go, just tell us where you're located. I know you have 2 locations.
Yep. So we have 2 locations. The first is in Boca Raton, 1601 Clintmore. It's in a big doctor's office just east of Military Trail on Clintmore. And then our other office is 2828 South Seacrest in Boynton Beach, right across from Bethesda Hospital East.
Hey, I live over there. I know exactly where that is. Now I know where that is. We'll be right back with Dr. Eric Shapiro talking orthopedic surgery on the You and Your Doctor show. Fantastic.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists and aides established are met, we say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, Living a Longer and Healthier Life. We're here with Dr. Eric Shapiro, orthopedic surgeon here in Boca Raton and also Boynton Beach. I'm going to give out the Boca Raton number, 561-395-5733. I'll give it out again as well. Dr. Shapiro, we talked a lot about non-surgical approaches, and I saw something on your website. You can help out people and companies with workmen's compensation claims. I know that goes hand in hand with orthopedic surgery because there are a lot of, unfortunately, there's a lot of incidents at work, a lot of injuries sometimes. So you're actually an expert in this field as well.
Yeah, so a lot of people, I think probably most things in workman's comp are actually orthopedic. So basically, I treat every patient the same. So I don't care if you have private insurance, Medicare, workman's comp, or no insurance, you're going to get the exact same care from me. So basically, I am always in it for the patient first, but then when it's workman's comp, we also have to report to the company. So the goal is to get the patient as healthy as and fast as possible and get them back to work. So the protocols to do it on each, the knee or the shoulder or the back, are the same for the workman's comp patient, but you're also dealing with the employer because the employer wants their patient back to work.
Definitely, because they have a bottom line. They have a business.
Yes, they do.
Definitely. Let's talk a little bit about your education and training. How long have you been in South Florida? I know you've done 7,000 surgeries. You've been around here quite a while.
Well, for the ones that see the visual, they see my gray hair, so they know I've been around for a while. So I started my 25th year. I actually grew up in a small town in Maine. I went to medical school at University of Vermont, College of Medicine in Burlington, Vermont. Did my 5 years of orthopedics in New York, and then did my fellowship in sports medicine at New England Medical Center in Boston. Was actually offered to stay in the New York area and take over the New Jersey Devil hockey team, which if I had been smart, they won the Stanley Cup that year. I would have had a Stanley Cup ring.
I remember that.
But I came down. And really, I started with Orthopedic Surgery Associates in 1994, and I am still there, and now I'm the managing partner president. So I started as the youth, and now I'm the old man. But we have all quality. Everything is about quality and patient care, and the bottom line is for people to do well.
And I was talking with you during the commercial break, and you said if there's one thing that could get you in a little trouble at your practice is you spend much time with some patients that you end up getting behind during the day, and your staff says, Dr. Shapiro, come on.
I actually tell my friends that in the patients who complain, I said, you want to be the 8 o'clock in the morning appointment or the 1 o'clock in the afternoon, because I catch up before lunch. But when I walk into someone's room, they're the only person there is. They're the only patient. So it's important for me. I explain to my patients what's wrong. I don't talk to them. I talk with them. I explain the x-rays. I explain the MRI. And my patients do very well, I think way better than the norm, because they understand it, and I make sure they don't hurt themselves. So it's imperative for me to talk to every patient. I follow up on all my post-ops to make sure they're doing everything right. I probably see my patients more post-op than others. I care too much that I have to make sure they don't hurt themselves. So as I think the only knock against me ever is sometimes there was a little wait. If the 10:30 appointment or the 3:30 appointment may not be the best one to get.
Well, I'll tell you, as you know, the general public, we appreciate that you taking the extra time. And I've heard great things about you, and just meeting you today and getting to talk to you, I can tell what kind of doctor you are. You're very personable, and you go the extra yard, if we were kind of keep it in sports terms, that you take that, go that extra mile. And I got to tell you, your practice is a who's who of people, of the doctors in orthopedic surgery in Palm Beach County. I mean, just the names in that practice. When I looked you up earlier this week to see, what kind of questions I could kind of stump you on, it's a really great practice. It really is. And then we were talking during the commercial break. All the doctors from the other, organizations. You were just telling me about a doctor who interned under you. So that's really impressive, and I think that's great. I want to give people the website as well, because you can check out Dr. Shapiro and some info. There's a lot of great info on the website. It's ortho-surgeon.com. So check out the info there if you missed the address or the number. They're in Boynton Beach and Boca Raton. One thing we haven't hit on is where do you, if it is a surgical approach and it does turn into a surgery with an individual, where do you do your surgical procedures at?
99% of my knee surgeries, I do at an outpatient center.
Okay.
I either do them at a place called Bethesda Health City or a place called Daslick in Delray. So the only reason I would do a knee procedure at the main hospital if the person was on Coumadin or if they were sick, just to make sure that they were safe. Otherwise, my rotator cuffs, if it's a young person, I'll do them as an outpatient. My older patients, what is older, probably Medicare 65 and older, I normally do them at the main hospital, at Bethesda Hospital, and keep them overnight and let them go home the next morning. I do that, one, for comfort's sake. For two, the spouse is usually scared and don't want them home that first night, and it just reassures them. That is probably not the norm. Most of the young guys coming out of their fellowship, they do the operation, they send them home an hour later. I just feel more comfortable. I think it's a nicer care. I'm not sure how much longer the insurance companies will allow that, but I think it's in the patient's best interest to stay overnight in the hospital if you're older, and I just want to take care of them better that way.
And you mentioned I live over by Bethesda Hospital East. Do you also on staff at Bethesda Hospital West then too?
I am on staff at West. I've actually never operated on at that location. My partner's Dr. Grandick has one full day. He does 5 or 6 knee and hip replacements at West. I heard it's a beautiful hospital. The people like it because it looks like the Taj Mahal.
It does look nice.
And the quality of care is excellent. But I just, when you've been here and you do things a certain way for so long, I sort of just, I do it the same way. So I have my block time on Wednesday morning at Bethesda, and I've been doing it for, like I said, in my 25th year. So I just sort of do things the same way. I've been very privileged. I've never had an infection on any of my patients, knock on wood, and really no complications. So I continue to do things the way I started, and that way it's worked for my patients. It's not like you're in New York City and you never see your patients. I see my patients at the drugstore, at restaurants, at Publix, things like that. So they always look at me because they think, I think I know that guy, but they don't think like I have a real life. So so I really care, and I've played golf with the people that I've done their rotator cuffs a bunch of times. It was a threesome in me, and I had fixed everybody's rotator cuff. So it's fun to.
They probably beat you too.
That's not that difficult.
Me neither. But I gotta mention Bethesda Hospital East. I've never had a family member at the West one yet. It does look great, like you said, though. But I did have a family member at the East. Fantastic hospital. I live over there. Is a very busy hospital in East Boynton Beach. But and a shout out to Dr. Fred Love, who when I was a reporter, I got to interview Dr. Love. So, man, what an amazing! Just thinking back right now, what an amazing man.
Very good person. I knew him as well.
Yeah, as well. So, thanks. We got about 2 minutes, so now I'm gonna kind of go into the lightning round. What are your hobbies and passions in life outside of medicine? I know you mentioned golf.
Yep. Well, what got me into orthopedics was I played 3 sports in college.
That's right.
And I've had 5 knee operations, an Achilles repair, a wrist reconstruction. So all my patients say, oh, you don't know how I feel. Unfortunately, I do. So that's another reason I went into orthopedics. I lift weights. I play golf. I love to ski. Don't get to ski that much now that we're in Florida, but I ski usually once or twice a year. I go out to Colorado. I've got 3 kids, 1 doctor, 1 going to be a lawyer, and 1 MBA. So
great job.
Been married for 32 years.
Congratulations.
And a lot of time spent at work, but I try to enjoy and spend it with a family. And I've got all my kids coming down for Thanksgiving, which is great. and just and be in the community.
It's nothing like family as they get older. I mean, that's heartwarming. I have a 16-month-old daughter, and just the family's coming home.
Congratulations.
I got to just chime in. We got one more minute. First time I ever skied, Temple Mountain, Peterborough, New Hampshire. So love it up there. What was the town you're from in Maine?
I am from Waterville, Maine.
Waterville. You said that's north of Portland?
It is
up
an
there.
hour and a half north of Portland.
A little bit of snow up there this
A
time
lot
of
of bit of snow up there. Yeah.
From now until
and that's why,
summer, right?
And that's why I live here.
Well, good move. We're glad to have you in the area. And please come back to the show anytime you'd like, and let's talk a little bit more about the areas of interest
Thank you.
that
Enjoy
you're
it.
helping out the community with. And we'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding spot